Okay, should be ready when you are.
Great. Thanks everybody for joining us for this webinar. We're going to talk about the Supreme Court ruling that was announced last Friday. Our presenters today are, I'll let them introduce themselves. Can each presenter introduce themselves, please?
Hi, this is Larkin Taylor Parker. I'm the legal director of the Autistic Self-Advocacy Network.
Hi, this is AJ Link.
Hello,
I use
everyone.
he, him pronouns. Sorry, Donnie. I'm policy.
Hello, I'm. Hello, everyone. My name is Donnie Denome, and I'm the Publications Associate at ASAN.
AJ, can you introduce yourself now?
Oh, I'm sorry. I apologize, Donnie. I'm AJ Link. I use he, him pronouns. I'm a policy analyst.
Great. Okay, let's go ahead and get started.
When a person is pregnant, they have a new human growing inside of them. This new human is called a fetus. An abortion is when the person decides to end their pregnancy without giving birth. We say pregnant people instead of women to include all people who can get pregnant. Some transgender men and non-binary people can get pregnant. Also, not all women can get pregnant. There are a couple ways that abortions happen. One is a medication abortion. This is where a pregnant person takes pills that are designed to end their pregnancy. Another is a surgical abortion. This is when the pregnant person has surgery to end their pregnancy. People have lots of debates about abortion. Some people say that abortion should be illegal. Other people say that abortion should be legal. ASAN believes that abortion should always be legal. We believe people have the right to bodily autonomy and self-determination. Bodily autonomy means people control what happens to their bodies. Bodily autonomy means people get to make their own decisions about their bodies. All people have the right to bodily autonomy. Self-determination is the right to make choices about your own life. Self-determination means people get to choose what they do with their lives. All people have the right to self-determination. When abortion is illegal, pregnant people can't decide to get an abortion if they need one. That interferes with pregnant people's bodily autonomy. It interferes with pregnant people's self-determination. Right now, abortion is legal in some states. Abortion is not legal in other states. We will talk about why this is in a later slide.
Why does abortion matter to people with disabilities? People have abortions for lots of reasons. We think that about 1 in 4 people who can get pregnant will have an abortion over the course of the years when they can bear children. Some reasons people get abortions are if they don't want to be pregnant and have a child, they cannot afford to be pregnant and have a child. It is not the right time for them to be pregnant and have a child. They already have children who they need to focus on, and being pregnant and having another child would take away from that. Abortion matters to people with disabilities for a lot of reasons, including the reasons we just talked about. Here are more reasons why abortion matters to people with disabilities. For some pregnant people with disabilities, pregnancy would hurt or kill them. Getting pregnant would make their disability worse, for example, epilepsy. And some people with disabilities take medication that would hurt the fetus if they got pregnant. Being able to choose if we have children or not is a part of bodily autonomy and self-determination. Being able to choose when we have children is a part of bodily autonomy and self-determination. People with disabilities should be able to choose if we have children. People with disabilities should be able to choose when we get pregnant. If we don't want to be pregnant, we should be able to get an abortion. People with disabilities have a long history of other people not respecting our bodily autonomy and self-determination. For example, forced sterilization. Having the right to get abortions is one way we can have bodily autonomy and self-determination.
What is Roe v. Wade? Roe v. Wade was a court case decided in 1973. We sometimes call Roe v. Wade Roe for short. A woman who used the fake name Jane Roe for privacy needed an abortion in Texas, but Texas law said that abortion was illegal. So Jane Roe brought a lawsuit to try to change the law so she could get an abortion. A lawsuit is when you take someone to court. You tell the court what the person did or is trying to do to you. Then you ask the court to tell the person what to do. The case made its way to the Supreme Court. The Supreme Court is the highest court in the United States. They have the final say on laws. The Supreme Court is made up of 9 justices. Justice is what we call a judge on the Supreme Court. The President of the United States picks justices to be on the Supreme Court. Supreme Court decisions matter to people with disabilities. Some Supreme Court decisions said people with disabilities have certain rights. Other Supreme Court decisions said people with disabilities do not have certain rights. The Supreme Court made a decision in Roe v. Wade. They decided that it wasn't okay for states to make abortion illegal altogether. The Supreme Court said that states could make some laws about when abortion could be illegal, but the Supreme Court said that states had to let abortions be legal at least for the first few months of a person's pregnancy. A typical pregnancy is about 9 months long. The Supreme Court made rules about abortion based on how long someone had been pregnant. The Supreme Court said that abortion had to be legal during the first 3 months of pregnancy. The Supreme Court said that states can pass some laws about abortion in the second 3 months of pregnancy, but the laws can only be to protect the health of the pregnant person. The Supreme Court said that the states can pass laws to make abortion illegal in most cases in the third 3 months of pregnancy.
What is Planned Parenthood v. Casey? In 1992, the Supreme Court made a decision in another case called Planned Parenthood of Southeastern Pennsylvania v. Casey. Planned Parenthood is a group that provides abortions and other kinds of health care. Planned Parenthood brought a lawsuit against the state of Pennsylvania. because Pennsylvania had passed laws making it harder to get an abortion in that state. The lawsuit made its way to the Supreme Court. The Supreme Court made a decision in that case. The Supreme Court decided that abortion would still be legal, but the Supreme Court also decided that there could be more laws against abortions. Before, the Supreme Court said that laws about abortion needed to be based on how many months someone was pregnant. Now, the Supreme Court said the new system would be about fetal viability. Fetal viability is whether the fetus can survive outside of the pregnant person's body. States could only pass laws making abortion illegal once the fetus could survive outside the pregnant person's body. This meant that states could pass laws making abortion illegal earlier in people's pregnancies than before.
States have been passing laws to make abortion illegal in their state. States have been trying to do this since the Supreme Court decided Roe in 1973. But some states have especially been trying to make abortion illegal in their state in the past few years. For example, in 2018, the state of Mississippi made a law saying pregnant people couldn't get abortions if the fetus was more than 15 weeks old. A fetus is not viable at 15 weeks old. A fetus cannot survive outside the pregnant person's body at 15 weeks old. So, Mississippi's law goes against what the Supreme Court said in Casey. Continuing our example, but Mississippi still made the law. Mississippi still wanted abortion to be against the law after 15 weeks of pregnancy. Mississippi's law was part of another Supreme Court case. We will talk about that case in the next section.
What is Dobbs versus Jackson Women's Health Organization? The Mississippi case is called Dobbs versus Jackson Women's Health Organization. Dobbs versus Jackson Women's Health Organization is another Supreme Court case. The Supreme Court decided it this year in 2022. We sometimes call Dobbs versus Jackson Women's Health Organization Dobbs for short. In 2018, the state of Mississippi made a law saying pregnant people couldn't get abortions if the fetus was more than 15 weeks old. This went against what the Supreme Court said in Roe and in Casey. Mississippi asked the Supreme Court to change its mind. Mississippi wanted the Supreme Court to undo its decisions in Roe and Casey. The Supreme Court made a decision in Dobbs. The decision said the Supreme Court would undo their decision in Roe and Casey. That means that Mississippi's 15-week ban would be legal. It means states can make abortion illegal altogether again. It means that in some states, pregnant people can't get abortions at all anymore. This is a very bad decision. It means abortion is no longer a right in the United States. This decision is already affecting people. Many states have laws against abortion now. People who need abortions now can't get care in many states. Some states have not banned abortion yet, but likely will soon. This will force people to need to travel to get abortions. Many people will not be able to do this. Those people will not be able to get abortions, even if they need abortions. This decision is not right. It is not fair. Everyone who needs an abortion should be able to get one. People shouldn't have to travel between states to get abortions. ASAN and another disability rights organization DREDF or DREDF, filed an amicus brief in the Dobbs case. An amicus brief is a way for people who aren't part of the lawsuit to tell a court what decision it should make. The brief explains how important it is for people with disabilities to make choices about our own bodies. The brief says that the Supreme Court should decide to keep its decision in Roe and Casey.
What does the brief talk about? The 15-week abortion ban would deny the bodily autonomy of pregnant people. People have bodily autonomy all the time, including when they are pregnant. Bodily autonomy means people control their bodies. Nobody else should decide what another person does with their body. But if the Supreme Court agreed with the 15-week, but because the Supreme Court agreed with the 15-week abortion ban, they have said pregnant people don't have bodily autonomy. That is not right. The 15-week abortion ban would be especially bad for people with disabilities. Some people with disabilities get worse. Some disabilities get worse while a person is pregnant. Some can get dangerous if the person with a disability doesn't have an abortion. In some cases, people can die. But not all people find out about their pregnancy early, before it's 15 weeks along, or before even less time has passed in some other states. And some disabilities that can put someone's life in danger in pregnancy only do that later on in pregnancy. A lot of places now have really limited access to abortions. Some states only have one clinic left that performs abortions, and some states, ever since this decision, have none. That means that people with disabilities who need an abortion may have to travel out of state. But not all of us are able to travel easily to a different state that may be far away. Some people need time to consider making choices about whether to have an abortion. This decision takes away abortion access for many people with disabilities. The exceptions in Mississippi's abortion ban that we discussed in our brief are not good enough. The Mississippi ban has some exceptions for abortions after 15 weeks of pregnancy, but those exceptions don't cover many reasons why people with disabilities might need abortion. There is an exception if the pregnant person's life is in danger, and there is an exception if continuing the pregnancy will hurt someone physically in a bad way that can't be undone. But the ban doesn't say anything about hurting someone mentally or emotionally. Some disabilities can get really bad during pregnancy, but they don't put the pregnant person in danger of dying or in danger of getting physically hurt in a way that can't be undone. So the exceptions to this ban are not good enough. People with disabilities are more likely to be poor than people without disabilities. It could take a person with disabilities a long time to save up for an abortion. They might not be able to afford an abortion before the 15th week of pregnancy, and then might not be able to get one at all. A ban on abortion might lead to more people with disabilities getting sterilized against our will. When someone is sterilized, they have a surgery so that they can't ever get pregnant. If we are under guardianship, our guardians might decide to sterilize us so we can't ever risk getting pregnant. Our guardians might do this because people with disabilities are more likely to be sexually assaulted. Sexually assaulted means being forced to have sex with someone. And there is no exception in this ban if we get pregnant from being sexually assaulted. The right not to be sterilized is related to the right to abortion because both have to do with bodily autonomy and making choices about our own bodies. Being able to get an abortion is part of bodily autonomy. Because the Supreme Court agreed with Mississippi's 15-week abortion ban and opened the door to abortion bans in other states, it has hurt bodily autonomy. This may lead to people not being able to have bodily autonomy in other ways, like people with disabilities being sterilized or forced to have abortions.
Why are some people so angry? People are angry because the Supreme Court undid the decision in Roe v. Wade. Abortion doesn't have to be legal anymore. Different states can say that abortion is illegal in those states. People can't get abortions anymore in states where it is now illegal. This is very bad. People have bodily autonomy. A pregnant person should be able to get an abortion if they want one. Banning abortions does not stop abortions from happening. It only means people who want abortions might have to do illegal things. And it would mean that pregnant people might have to travel long distances to get abortions. Some states are making abortion illegal. Other states are not. Some people will have to travel between states to get an abortion. Traveling between states to get an abortion costs a lot of money. This would mean people who don't have a lot of money couldn't travel to get abortions. This would especially hurt people with disabilities who need abortions because people with disabilities are more likely to not have a lot of money. Many of our rights are now in danger. It's not just the right to abortion. The Supreme Court talked about putting other rights in danger. They did this on purpose. One of the justices on the Supreme Court wrote that he wanted to take away other rights, like the right to get birth control. Birth control is medication that makes it so you can't get pregnant as long as you keep taking it. The justice also wrote that he wanted to take away the right of two adults of the same gender to get married or have sex with one another. Now we are worried the Supreme Court will take away a lot more of our rights.
So, what can we do? We can talk about abortion and bodily autonomy with others. We talked about how abortion is really common and lots of different people have abortions. It's important to talk about how abortion is normal. It's important to talk about how everyone has the right to bodily autonomy. It's important to talk about how everyone has the right to self-determination. That way, more people can learn about these topics. Not everyone will agree with you. People have many different opinions about abortion. But some people will agree with you. They can help you advocate for abortion access. We can look out for different ways you can advocate. Different groups have different ways you can help them with their advocacy. For example, ASAN might send out an action alert asking you to contact your elected officials. We can advocate for laws in our states that make it easier to get an abortion. Right now, each state has different laws. Some states make it very easy to get an abortion. Some states make it very hard to get an abortion. Advocate for laws in your state that make it easier to get an abortion. You can learn more about your state's laws and bills about abortion in the links on the slides. I'll also post those in the chat so you have them. You can give money to abortion funds, if you can. Abortion funds are groups that give money to people who need abortions. Abortion funds run off of donations, meaning other people need to give money to them. Abortion funds are very important. They help people pay for abortions, traveling to get an abortion, and other related costs. You can find a national list of abortion funds at abortionfunds.org/funds. I'll put that link in the chat. Thank you so much for coming. We have some time for questions now, if anyone would like to ask.
Hi, we have some questions. I'm going to read them from the chat. One question is, how can abortion rights advocates be more inclusive of disabled people? Is there ableist rhetoric, tactics, policy proposals that need to be avoided?
I'll jump in and address that one if I can.
Go ahead.
There certainly are. There's a touchy history between disability and repro groups because of everything from ableist rhetoric in the present to the history of eugenics in this country in some ways. But there have been efforts in recent years to bridge that divide, and it's going to be absolutely crucial that we keep doing that. Some things that can be done are making sure that materials and trainings are as accessible as possible, advocating for the existence of abortion care and other reproductive health care that is accessible to disabled people, and avoiding messaging that talks about life with a disability as not worth living and really devalues people with disabilities. There's a lot of common ground to be found, provided your advocacy is inclusive. Probably more common ground on the substantive policy than anything else.
I also think making your protests accessible, especially during the pandemic, making sure folks are wearing masks and being cautious during in-person protests, but also having virtual protests and virtual platforms for folks who cannot be out and in person.
I'll add that talking about bodily autonomy is very much a common ground between a lot of reproductive justice groups and disability organizations. Bodily autonomy is something that we very much care about, both from the perspective of not being subject to medical treatment without our consent, and in the same way of reproductive justice related things about abortion care, about contraceptives, making your own medical decisions. It's a very good common ground to talk to reproductive justice organizations about, and vice versa. We talk a lot about the intersections here. I also recommend while, working on being inclusive of disabled people, making sure that at the same time, both disability orgs and reproductive justice orgs are being inclusive of a lot of the other intersectional issues that go along with this. People being denied gender confirming care, for example, the history of forced sterilization that affects not only people with disabilities, but also people of color in the United States. Those are all things that I would be careful about. Our next question is, based on legal opinions, will possible state control of birth control only affect women presenting people, or will it affect any gender or any contraceptive? Asking for personal clarification and to be sure that the fight for bodily autonomy is not heavily gendered.
I don't think anybody on this call is an attorney licensed in your state, and we can't provide you with individual legal advice, but we can say that's a really concerning issue. How that comes out, what happens with different forms of contraception, which are legal, which remain illegal, which become illegal, may be much more in the hands of the states going forward. There is still legal precedent supporting a right to access to birth control all across the country, but some states are writing their abortion bans in ways that are starting to put pressure on that precedent and may give rise to more lawsuits, may cause people to bring lawsuits that give the Supreme Court opportunities to limit access to birth control. So that is a very concerning issue. No one knows exactly what will happen at this point. And we're hearing stories of some healthcare systems already starting to limit access to things like Plan B because of laws that are being passed by states in different states. So there's a lot of uncertainty and confusion, which will harm people in and of itself.
All right, our next question is, if my state is a sanctuary state, which is in quotes, what are ways we could encourage legislators and medical stakeholders to include the disability community in getting access to abortion and other essential reproductive needs from state and municipal/local level? So to clarify that question for anybody who needs plain language, this is asking is, if abortion is legal in your state and a lot of people come to your state for abortions, how can you talk to the people who make laws, legislators, and doctors and medical organizations to make sure that the disability community is included and people who are in that state can get access to abortion and reproductive needs, but also that people who are coming from other states can get access to abortion and other reproductive care? And this person is asking about what they can do on the state and local level.
So if your state is a sanctuary state, that's a great start. It's important to ensure that abortion care is as accessible as possible to ensure that people with disabilities are not left out. That gives state legislators a lot of room to do things like work to ensure that clinics have accessible medical equipment and accessible materials, and find ways to make it easier for people to get themselves to a clinic once they arrive in a particular state, whether or not they can drive. Any funding that states want to provide for abortion, especially if even out-of-state residents are eligible, would be very helpful to people with disabilities and other marginalized people who are disproportionately poor. There are a lot of creative solutions. The sky's the limit here. It really depends on how much the state legislature in your state is willing to do for out-of-state residents.
I would also add that it's really important to engage your local disability advocacy organizations, because they know their access needs in your local state or municipality. And it's really important to include them in your advocacy and lobbying efforts, oftentimes because they can best express their needs from their experiences.
Great. Our next question is ASAN affiliated with the ACLU? Are they aware of the harms this ruling has on the disability community? And I'll say that ASAN has worked with the ACLU on multiple issues before. Does our policy team have anything to add there?
Not really. They're certainly coalition partners we have worked with before and expect to work with again. And they are aware of the harms of this ruling. I know that they've been involved in litigation to keep state abortion bans from taking effect.
Our next question is, what is the position of ASAN on abortion solely based on the probability of the fetus having a disability, such as Down syndrome? We get this question and are having a difficult time finding a position that is consistent with our views on abortion access.
This is a hard and painful issue for the disability community, and ASAN completely understands that and understands the impact of that kind of devaluation of the lives of people with disabilities. But our position is always open access to abortion. While being resistant to having a child with a disability specifically, as opposed to a child in general, is not very consistent with our views of disabled life and value. We ultimately believe that everybody gets bodily autonomy, even if that they exercise it in ways and for reasons that may be upsetting or discomforting to some of us. The disability community has fought so long and hard to have any control over our own bodies that we feel the need to take a very hard line on that. Compromising it for any reason creates dangerous slippery slopes that we have seen in this country's history before. And we don't want to open those doors again.
So I linked in the chat our position statement on genetic research, which talks about among other things, the idea of prenatal tests that could potentially, predict autism. We talk about our concerns and our concerns about the accuracy of tests. For example, prenatal tests for rare conditions are wrong about 8 out of 10 times. But as we say in the genetic statement, we support the legal right of any person to have an abortion for any reason. Every pregnant person should be able to choose whether to have a child or not. People should be able to choose without anyone or anything forcing or pressuring them. We also know that we live in a very ableist society, in a country where people with disabilities and our families do not get the support we need. We are worried that ableism and lack of support are ways society uses force when people are thinking about whether or not to have an abortion. Instead of prenatal testing, we want to get rid of ableism, and we want to see better support for people with disabilities and our families. TJ brings up the fact that this ruling can also affect people with sickle cell, which is less talked about disability. Are there any other questions? We have a question. Any tips on communicating with anti-abortion disability advocates?
I think to the extent that it's possible to find common ground with them, that's going to come through acknowledging the very ugly history around reproductive issues for our community and other marginalized communities, particularly in this country. We may not always be able to find agreement and common ground, and our community is not a monolith. But I think productive conversations may be possible where we can acknowledge that we have fully considered that history and just reached a different conclusion. The one where we've decided that bodily autonomy is paramount and is something we have to protect.
I would also add that it's important that we talk about how the same rights that we have that affect whether or not someone can get an abortion affect whether or not someone can start a family when they choose to. Because any threats to bodily autonomy and self-determination, making your own medical decisions, can also affect sterilizations. So when we are talking about this issue, it's just as important that we talk about people who want to start a family, as when we talk about people who do not want to be pregnant. So that is a potential opportunity to find common ground there, to talk about the importance of bodily autonomy, and that includes the history of forced sterilizations in the United States.
I would say emphasize bodily autonomy and draw parallels to how people use bodily autonomy in other situations. Like everyone else has said, it's important to center bodily autonomy and the right to make our own decisions for ourselves, even if others disagree.
Great. Are there any other questions? I'll give it a couple minutes to see if there are any other questions. In the meantime, I did want to mention to everyone that we have a written resource, Our Bodies, Our Rights. This webinar is based on that resource. If you'd like to learn more or want to review the content that we talked about today, you can find that in Our Bodies, Our Rights, which is available on the ASAN website. This webinar will also be on our YouTube channel. And then this webinar is part of a 3-part series. So next week at this same time, so that would be July. Oh. Can someone pull the date, please? July 7th. Okay. July 7th at 6 p.m. We'll be talking about the legal implications of Dobbs. That's our webinar, Where We Are Heading. The legal implications of Dobbs webinar talks about the other civil rights that are affected by this decision. We mentioned them here, but that includes the right to birth control and contraception, the right to marriage, the right to engage in sexual activities with a consenting adult. Then the Thursday after that, July 14th at 6 p.m., we will be talking about reproductive justice as disability justice and focusing on the intersections between reproductive justice and disability justice and how our communities can work together on this issue. Those will be the next 2 weeks. All right. Donnie wants to add that the Our Bodies, Our Rights resource is slightly outdated. It was written before the Dobbs decision came out. We are working on updating it as quickly as possible to have a revised version that talks about the Dobbs decision. So we have another question about will ASAN also fight for proper sex ed?
Yes, that's an issue we remain concerned about, and we will always be for comprehensive sex education for people with disabilities, including and especially IDD.
All right, we have a question on a similar topic. Hello, I am coming in from the perspective as a special education teacher. One thing that is lacking is curriculum addressing sex. Do you feel like with the current discussion from SCOTUS that there needs to be a bigger push for a sexual education curriculum?
There does. It's always very important, but it particularly is now. And now that abortion is going to be a much more state-by-state issue for the foreseeable future, that needs to include what the law in someone's particular state is and what might be necessary, how far they might have to travel, and what their options are if they do find themselves in need of abortion.
Definitely. I think that is a crucial part of sex ed, is learning about how to access these resources. And with abortion care being more difficult to access in a lot of states, it's so important that we're making sure that our communities, especially the community of people with IDD, are informed about options, access, and so on. Are there any other questions? Okay, great. Thank you everyone for joining us tonight. This is going to be a very long, very intense fight. I think that, this is going to be something that we really need to mobilize as a community against. And I appreciate everyone coming out here and joining us tonight. It's a very scary and intimidating time right now. A lot of people are concerned about what might happen to themselves and their family. Want everyone to make sure to practice self-care in whichever way works for you. And make sure that you have taken care of yourself, and then join in the fight in whichever way works for you. State advocacy is going to be crucial on this issue. And we hope to see all of you involved in state advocacy on this. Are there any other closing thoughts?
Just that we're here for you in this difficult time. We understand that this will have a significant adverse impact on people with disabilities and pretty much all other marginalized people and communities in many parts of the country. And we will be doing everything we can to keep our community safe and protect our bodily autonomy.
Great. Thank you, everyone. Have a good night.